Hello, this is Dr. Jerry Law, Director of Family Education and Leadership Training for Meadows Behavioral Healthcare. I'd like to thank you for watching this video on the importance of self-care while your loved one is in treatment. Quite often, while working with families who have a loved one receiving care in one of our programs, I am asked by these family members how they can best support their friend or family member. Others simply don't know what to do for themselves during this critical period, as so much of their time and efforts have been devoted to caretaking the loved one who is now with us. So I'd like to share some thoughts and recommendations on how to practice self-care. As counterintuitive as it may seem, one of the best things you can do for your loved one at this time is to take care of yourself. Many of you are just now finding out how much your loved one has been struggling, while others of you have been dealing with the issues at hand for months or even years. Regardless, the practice of self-care will be one of your best approaches to supporting your loved one. So let's start with taking a quick look at the whys of self-care. According to blogger Kristen Wong, self-care isn't just important, it's crucial. She states, and I quote, "It's easy to neglect taking care of ourselves because we're busy and overwhelmed. Even a small reprieve feels like a luxury. So actually taking time to eat lunch, exercise, and hang out with friends, well, that just feels like slacking." That mindset backfires though. Self-care actually helps you progress faster for a few reasons. Number one, self-care prevents overload burnout. We've all been there. You push yourself to the point that you just can't take anymore, so you just give up. Self-care helps you avoid getting to that point. Number two, self-care reduces the negative effects of stress. A small amount of stress can serve a purpose, but after a while, it just breaks down your mind and body. Taking care of yourself means keeping your stress from taking over so you can function at full capacity. And number three, self-care helps you refocus. When I was stuck on a complicated math problem in school, my teacher would suggest walking away and coming back. In other words, take a break. Breaks are the epitome of self-care, and studies show they're great for helping you perform better. So, here are a few practical tips for practicing self-care. First, educate yourself. At Meadows Behavioral Healthcare, we treat a wide variety of disorders, and your loved one may be facing more than one. Perhaps you're already aware of the diagnosis, or you may just now be hearing about it. Regardless, I am convinced that education is one of the keys to developing healthy skills that will empower you to be part of your loved one's support team. It goes without saying that much misinformation still abounds regarding mental and behavioral health issues. I know that many of my own assumptions and preconceived ideas about these disorders have turned out to be inaccurate. Well, as we all know, just because it's on TV or on the internet, that doesn't mean it's true. We must learn to be our own advocates for truth when it comes to learning about the disorders our loved ones are facing. One of the reasons we've developed an extensive online bookstore is to be able to provide recommendations for cutting-edge, evidence-based research and findings for our patients and their families. Please visit our website at www.themeadows.org and click the link to the bookstore. There you will find a wealth of books and videos that feature the work of the Meadows Senior Fellows, men and women who are leaders in the field of behavioral health care. Our team will be happy to make recommendations for books and other materials that will assist you in better understanding the issues at hand. I know that education has been one of the most crucial components of my own recovery. Gaining insights into the human brain and what may impact cognitive function has been a godsend for me. Let me also recommend some websites for additional education and educational resources. First, www.addictionhope.org. Good resources there. If your loved one is facing eating disorder, check out www.iadp.org. That stands for the International Association of Eating Disorder Professionals. Next, www.drugabuse.gov. That's .gov. That's the website for the National Institute of Drug Abuse. You can also check out www.eatingdisorderhope.org. And a final one is www.nih.nih.gov. That's a long one, and that's the National Institutes for Health website. Now, let's talk a minute about therapy. In many cases, friends and family members are so focused on the needs of their loved one that they may lose sight of the impact the disorder at hand may be having on themselves. Your loved one's time in treatment may provide you with an excellent opportunity to take advantage of some therapy for yourself. If you have a therapist you work with, we encourage you to do a check-in at this time. If you don't have a therapist, we can make recommendations for individuals in your area. Availing yourself to the services of a trained professional is truly a mark of growth and will not only provide guidance for you, but also send a powerful message to your loved one that you're making changes in your life that will positively impact your relationship. Another important form of self-care that you may wish to embrace is that of attendance in a support group. Many families mistakenly believe that support groups are a sign of weakness or that only their loved one needs this type of care. Nothing could be further from the truth. Being in a group of like-minded individuals whose experience, strength, and hope, born out of working through some of the very issues you are facing, can be life-changing. Well-meaning friends and family members who've never walked in your shoes often say things in an attempt to be helpful that come across as hurtful or condescending. There's just nothing like being surrounded by individuals who get it and can offer their support from a position of experience. Groups such as Al-Anon or Nar-Anon can be especially helpful if your loved one is in recovery from some sort of substance use disorder. CODA, C-O-D-A, or Codependence Anonymous, is a great resource for those of you who have a loved one with any form of mental or behavioral disorder, and you have found yourself in a caretaking role that pulled into unhealthy relationships. If you are seeking a faith-based support group, consider Celebrate Recovery or Parents of Addicted Loved Ones. Any and all of these groups can be found online. You may have a loved one obtaining treatment for an eating disorder. If so, consider groups such as Families Empowered and Supporting Treatment of Eating Disorders. Goes by the acronym FEAST, F-E-A-S-T, or Parent, Family, and Friends Network, PFN, which is affiliated with the National Association for Eating Disorders. You know, a quick Google search under the heading of support for family members of an individual with, fill in the blank, will bring up an extensive listing of support groups. Also, feel free to email me at jlaw, that's J-L-A-W, at themeadows.org, and I'll be happy to send you additional support group recommendations or the links to any of those already mentioned. This also may be a good time to check in with your family physician. A comprehensive physical exam may be overdue, or just consultation with your primary care provider may go far in giving you some guidance on self-care. The benefits of good nutrition and moderate exercise can also go far in assisting you to finding the balance you may need during this demanding time. How about journaling? It is a powerful tool that can help you pull your thoughts together. I know that early on in my own recovery, the idea of journaling was not attractive. However, at the direction of my therapist, I took the plunge and have found this to be a wonderful way of getting the committee in my head to quiet down. Writing down random thoughts as well as transferring full-blown conversations I've had in my own mind to paper often brings about clarity that I simply can't find any other way. I regularly read journal entries from months or even years ago and find great comfort in the progress that I've made, not only in my own recovery, but also in my understanding of improved methods for communication and relationship building. Give it a try. Another idea for self-care that I highly encourage family members to practice is that of mindfulness. Now don't worry, this is not some type of science fiction or psychobabble. Mindfulness is merely the practice of staying present in the moment. It is so easy to future trip or get stuck in the past. Mindfulness is not about pretending past problems don't exist, nor is it a way to refuse to face the future. Rather, these are techniques that help us recognize the value of the right now. A form of mindfulness that I find particularly helpful is deep breathing. The brain needs as much oxygen as possible to work to its optimal best. Deep breathing, as practiced by the Navy SEALs, is a powerful method for staying present while also oxygenating the brain. One last tip as we bring this video message to a close. In a word, laugh. I realize how inappropriate this may sound to you, but hear me out. Research has demonstrated that humor can be a great method of self-care. Knowing that your loved one's situation, as well as that of your own, may be anything but funny and nothing to laugh at, finding humor in some form can be very beneficial. Reruns of your favorite funny TV show, reading a joke book, listening to that old stand-up comic routine that you laughed at, or even the great Who's on First routine by Abbott and Costello can really lift your spirits and bring sunshine to an otherwise dark and dreary day. Well, thank you again for taking time out of your busy schedule to watch this video. But more importantly, thank you for taking time from your hectic life to practice self-care. It just may be the best thing you can do for your loved one.